You may not be able to eliminate all flares, but you can take steps to reduce their frequency and impact. Stay as physically active as possible in order to keep your immune system strong. Keep a food and symptom journal to help identify which foods seem to worsen your symptoms, and try stress reducers like meditation or reading. Most importantly, be sure to take all medications exactly as your doctor has ordered. But if a flare should develop in spite of your best efforts,
typically it's best for the patient to contact their doctor so that they can get some direct advice in managing it. And sometimes it is an increase of the dose of a medication that they're on. Sometimes it's the addition of another medication. And sometimes it's the use of an over-the-counter medication that may be specific for gastrointestinal symptoms. And it may be a medication that is used for other things and still might be helpful, such as acetaminophen or Benadryl, something like that.
But avoid taking nonsteroidal anti-inflammatory drugs such as ibuprofen or naproxen, unless specifically instructed by your doctor. NSAIDs have been known to trigger flares in some patients. When you do sense impending GI distress, it's important to eliminate those personal triggers you've already identified.
When my symptoms are active and in a flare, the things I do typically avoid food-wise are caffeine and other stimulants, particularly coffee. It seems to aggravate my symptoms more than most other things, and things that are very high in cellulose or roughage. So, green leafy vegetables are sometimes more problematic, or very fibrous things like skins of fruit, hard fruit, and things like that.
Another key while flaring is to take in an adequate amount of fluids that won't worsen your symptoms. Water may not always be the best choice.
When you're not having acute diarrhea, water is a great source of hydration. But when you're having acute diarrhea, sometimes we have to have what is called isotonic beverages. And isotonic beverages mean that they're balanced in terms of the solutes in the fluid. So in order to have that kind of balance in the fluid, you need to probably dilute sports drinks because it has enough sodium and potassium or electrolytes to help balance that intake in the gut.
Maintaining a level of hydration for yourself that allows you to be safe and function effectively, and yet doesn't exacerbate your condition and exacerbate the diarrhea is something that's a challenge, but it's something it's very valuable for you to work on.
Equally valuable, learning to pay attention to your body's signals, a key to taking countermeasures at the first sign of trouble. For WebMD, I'm Damon Maharg.